Hi guys, my name is Mustafa. Welcome to Bridging the Gap Academy. Today I want to talk to you about dry eyes. And the reason I want to talk to you about dry eyes is it's one of the most common things that can happen to any one of us. It's so common it can affect from 5 to 33% of people worldwide. Now imagine every third person next to you has dry eyes. What's the reason you have dry eyes? There are many. Most commonly, there's nothing to worry about, and we can do very simple things to help ourselves. I have dry eyes. When you have dry eyes, such as myself, it's a nuisance, and it can sometimes be the worst thing in the world. Now let's dive into why we get dry eyes and things that we can do ourselves to manage this. To be able to understand dry eyes properly, we have to first look into the anatomy and physiology of how tears develop and how they lubricate our eyes. If you look at this diagram right there, the letter A is the lacrimal gland. This is what produces our tears, or aqueous layer, which is the middle layer of a tear film. Now, from letter A, the lacrimal gland produces the tears, and these travel through letters B and E, which is superior and inferior punctums of the eye, and they drain into letters C and F, which is the superior and inferior canaliculi. Now, the superior and inferior canaliculi join to form a common canaliculus, and that drains into letter D, which is the lacrimal sac. Now, the lacrimal sac drains into the nasolacrimal duct in letter G, and that gets drained away into our inferior meatus, which is in the nose. Now, the reason people have dry eyes is maybe because we're not producing enough tears in the lacrimal gland, or maybe the tears are escaping through our nose too quickly, or maybe the tear film itself is not of good enough quality that the tears can stay in our eyes long enough and it evaporates too quickly. So what is the tear film? The tear film consists of 3 layers. The first layer is a superficial lipid layer produced by meibomian glands in our eyelids. The second layer is what we talked about, is the aqueous layer produced by the lacrimal gland. And the third layer is a mucin layer, which is produced by goblet cells in our conjunctiva. Now, all 3 components of the tear film are actually very important. And if they're not there, then we tend to get dry eyes and the tears can go away too quickly. Now, how are tears produced? If you're a medical student, you probably don't need to dive into all the knowledge that I've written right here. But if you're interested, or you're sitting the Duke Elder exam, or you want to be an ophthalmologist, then it might be important to listen. Tears are produced through a parasympathetic drive from our facial nerve. Now, that's probably all you need to know as a medical student. If you want to delve deep, that facial nerve specific nucleus is called the superior salivary nucleus, which is present in the caudal pons. Preganglionic fibers travel from there and are carried in the greater petrosal nerve. Now, these synapse in the pterygopalatine ganglion, and from there, postganglionic fibers travel with the zygomatic nerve, which is a branch of the maxillary nerve, and finally to the lacrimal nerve, a branch of the ophthalmic nerve, to reach the lacrimal gland to tell it to produce tears. Another important reflex that we have is the blink reflex. Now, blinking helps distribute the tears all around the eyes. And blinking is mediated voluntarily, I can blink right now, as well as a reflex through first division of the trigeminal nerve. As we said before, dry eyes happen in 5 to 33% of people worldwide. We touched upon what causes dry eyes. In terms of not enough tears being produced by the lacrimal gland, this could be due to an autoimmune condition such as Sjogren's disease, or it could be because of infiltration of the lacrimal gland through something like sarcoidosis. It could be age-related. The lacrimal gland is now inadequate and it doesn't produce enough tears. Or it could be some drugs such as anticholinergics or antihistamines. I've got some other reasons listed below if you want to have a look. In terms of maybe we lose too much tears, excessive tear loss, that could be because of the climate you're in. Maybe it's a climate with low humidity, or maybe you're not blinking enough. Say you're working or you're studying really hard, or say you are maybe playing games on the computer or watching TV. You tend to blink less, and if you're blinking less tears are distributed around your eyes, causing us to have dry eyes. And finally, changes in the tear film. So as we said, the first layer is a lipid layer. Now that layer stops tears from evaporating too quickly. If we have diseases such as blepharitis, which affect the meibomian gland, this layer doesn't come out very well, and so the tears evaporate well. Now, if a patient has blepharitis, the treatment is simple. Although blepharitis tends to be hard to treat, good hygiene and good warm compresses usually do the job. Finally, if you live in a third world country or a developing country where there's not enough vitamin A in your diet, this can affect goblet cells, and you can have vitamin A deficiency affecting the mucin layer of your tear film and causing you to have dry eyes, as well as other problems. What are some risk factors and what are things that we can control? Unfortunately, if you're a female, you have a 2-to-1 ratio of having dry eyes, and there's nothing you can do about that. Obviously, increasing age. Some studies have suggested that a diet deficient in omega-3 fatty acids is a risk factor for dry eyes, and this might be something that you want to supplement in your diet, having some omega-3 fatty acids. Something that we can stop is not use the computer screens too much, not play too much games, or taking breaks between those and making sure that we're blinking enough and we're not just fully focusing on one thing at a time. Other factors that we can stop is we can stop smoking, and if you stop smoking, that can help with dry eyes as well. And lastly, this is an issue that I have a problem with. I wear contact lenses, and whenever I wear contact lenses, it dries my eyes out a lot, and so I have to wear glasses like I am today. Now I wear contact lenses because sometimes you want to wear contact lenses, and sometimes maybe you're dressing fancy and you don't want to wear glasses, and that's fine. But if you wear too much contact lenses, then it can dry your eyes out as well. Features of dry eyes are very common. If you've had dry eyes before, you know what it's like. Your eyes can get dry, it can feel gritty, you can feel like there's something in your eye, a foreign body sensation. It might even go red and cause you some mild pain. And what are the signs that we can see? So your optician or ophthalmologist might look at your tear break-up time. And basically what they do is they put some fluorescein, they put a dye inside your eyes, and they ask you to blink a couple of times and then measure the time between the last blink and the time the tear film starts to break up, and that's your tear break-up time. If it's less than 10 seconds, then it says that the tear is breaking up too quickly and you have dry eyes. Another test is called Schirmer's test. You put a little filter paper in the lower eyelid and you leave it there for 5 minutes, ask the patient to blink normally, and then you measure how much wetting has happened after 5 minutes. If it's less than 5 millimeters, that suggests dry eyes as well. How do we manage this? First of all, is there a cause? Do we have a disease? Are we deficient in something? Are we smoking? Is there something obvious that we can treat? If so, then treat that. If not, we can look at other things we can do. There are lots of eye drops available, and there's eye drops, and there's gels, and there's ointments. Ointments last a bit longer, and it might be useful to put them before bedtime. And as I said, there's lots of eye drops. Now, I'm not an ophthalmologist and I'm not an eye doctor, so I'm not going to recommend any brand over the other based on my experience, but I will say that I've personally suffered from dry eyes and I use Hylo and it works really well for me. If you have dry eyes and you want to try it out, then I've got a link down below for you to check out. Now finally, if dry eyes is bothersome so much, you might be referred to your optician or your ophthalmologist and they might look at other things they can do. There's multiple things they can do, and I've put a list of a couple of things down here. One thing that I think is quite useful is they can sometimes put plugs inside your punctums that drain your tears away, and if they put these plugs in your punctums, then the tears won't drain too fast, and that way it stays in your eyes a bit longer, and so it treats dry eyes. I hope this talk was useful, and I hope it cleared up some things about dry eyes. If you had any questions about them, please leave them down below. If you liked this page and you learned something from it, please give this video a like and please give us a subscribe to help us create more videos for you.